Welcome in. If you're listening to this right now, it means you've got a curious mind. You're the kind of person we like to call the learner.
Exactly.
You might be prepping for a meeting or maybe trying to catch up on a highly specific field of medical knowledge, or maybe you're just insanely curious about the hidden structures of the world around you.
And how the systems we actually rely on work.
Right. Whatever brought you here, you've landed in the exact right place.
Yeah.
Our goal today is to give you a really clear, thorough, and hopefully highly engaging shortcut to becoming deeply well-informed.
On a subject that sits right at this fascinating intersection of biology, global commerce, and, honestly, consumer psychology.
Yeah, we have a massive stack of source material to get through today, and we've custom-tailored this entire journey specifically for you.
That is our central mission. We aren't here to just overwhelm you with a flood of disjointed data.
No textbook reading here.
Right. We're here to synthesize the information, spot the underlying patterns, and figure out not just what the raw data says, but why it actually matters to you and to the broader healthcare landscape.
Because knowledge is only really valuable when it's understood in context.
Exactly, and applied critically, which is what we're doing today with a very specific, incredibly dense set of documents.
So our dossier for this deep dive comes from an independent medical information platform called iMedix.
iMedix.
Right. And to give you some context on the source, iMedix operates as this massive digital hub for drug databases, educational resources, and patient safety discourse.
They basically catalog medications and track safety info to help people navigate a very complex healthcare system.
And the specific focus of our analysis today, the subject of this entire iMedix deep dive, is a generic medication called Fildena.
Fildena is a really compelling subject.
It is.
Because it sits perfectly at the center of a very tangled web. You have the pharmacology of the drug itself, the behavioral psychology of the patients seeking it out,
and the incredibly confusing reality of international regulatory oversight, which is really the hook for today's discussion. Fildena uses the exact same active ingredient as one of the most famous, globally recognized blue pills in the world.
I think we all know the one.
Oh, definitely. But Fildena exists in this somewhat shadowy regulatory gray area. It's broadly categorized as a generic medication. But as we dive into the iMedix database, we're going to see that the word generic carries vastly different meanings.
Depending entirely on who is doing the regulating.
Right, and where the drug is actually originating.
Which is why today's deep dive is about far more than just a single pill. We're using Fildena as a lens to really understand clinical pharmacology.
And exploring the real tangible risks associated with unapproved generics flooding the global market.
Most importantly, we're highlighting the absolute necessity of critical thinking when it comes to patient safety. We live in an era overflowing with accessible medical information.
It's everywhere.
And seemingly easy access to powerful treatments. But navigating that digital world safely requires a really rigorous level of scrutiny.
Which is exactly what we're going to model throughout this analysis. So let's start with the blueprint of the drug itself.
The basic pharmacology.
Right. Based on the iMedix database, at its core, Fildena is a medication utilized for the treatment of erectile dysfunction, or ED, in adult men.
And the active pharmaceutical ingredient inside this tablet is a compound called sildenafil citrate.
Sildenafil citrate, and that is, chemically speaking, the exact same compound found in the original brand name drug Viagra.
Correct. We're talking about a highly studied, very well understood molecule that has been heavily documented in medical literature for decades now.
And the source material gets quite specific about the actual mechanics of how this molecule operates once it's introduced into the human body. Fildena belongs to a class of drugs known as phosphodiesterase type 5 inhibitors.
PDE5 inhibitors.
Right. And clinically, a PDE5 inhibitor works by targeting the smooth muscle tissue lining the blood vessels. When we're talking about treating ED, the drug specifically facilitates the relaxation of the blood vessels in the penis.
It's all about vascular dynamics.
Exactly. As those vessels relax, they naturally widen, which allows for a significant localized increase in blood flow. That increased vascular engorgement is what enables a man to achieve and maintain an erection suitable for sexual activity.
The biology there is actually quite elegant. By inhibiting that specific PDE5 enzyme, the drug prevents the breakdown of another chemical messenger that promotes that vascular relaxation.
It's essentially removing a roadblock.
That's a great way to put it. It removes a roadblock in the body's natural circulatory response. But there's a massive misconception surrounding this mechanism that we absolutely have to clear up.
Oh, yes. Okay, let's unpack this because it's incredibly pervasive.
It fundamentally misunderstands how the drug interacts with the human nervous system.
We're talking about the aphrodisiac myth.
Mm-hmm.
There's this massive cultural assumption that taking sildenafil acts as some sort of magic switch for sexual desire.
Right.
But the iMedix documentation is completely unambiguous here. Fildena is not an aphrodisiac. It has zero effect on a patient's libido.
None at all.
You can't just ingest this PDE5 inhibitor and expect it to generate an overwhelming sense of desire or arousal if that psychological state wasn't already present.
The distinction between the physiological mechanics of vascular dilation and the complex psychological experience of arousal is crucial here. The medication only addresses the physical plumbing, so to speak.
Plumbing, yeah.
It facilitates the necessary blood flow, but it remains entirely dependent on existing arousal to trigger that process. The source explicitly notes that both physical and psychological stimulation are absolute prerequisites for the medication to be effective.
So without that initial neurological signal of arousal, the pill does virtually nothing.
Nothing in terms of its intended clinical outcome, correct?
It essentially sets the stage, but the brain still has to start the play.
Exactly.
And understanding that intended clinical use brings us to a very serious warning highlighted in the dossier from urologists. We're seeing this rising trend of recreational use.
Which is deeply concerning.
Men taking this drug for fun or for perceived performance enhancement when they don't actually suffer from a medical condition.
The source is emphatic on this point. Fildena is exclusively for men with diagnosed erectile dysfunction.
And ED is a specific clinical symptom.
It is. It's the consistent, repeated inability to achieve or maintain an erection sufficient for satisfactory sexual performance. Using a potent vasodilator recreationally without that underlying diagnosis is strongly discouraged by the medical community.
For several reasons, chief among them being that ED is rarely an isolated issue. It's often the canary in the coal mine for systemic health problems.
Precisely. Clinically, ED can be driven by severe cardiovascular disease, advanced diabetes, profound neurological conditions, or complex psychological factors.
And Fildena only treats the localized symptom.
It does nothing to cure or address the underlying pathology. So when someone bypasses a physician and uses the drug recreationally, they are bypassing a vital medical evaluation.
They might be masking the early warning signs of a severe heart condition.
Exactly. With an unapproved generic, rather than treating the actual disease process that's causing the vascular failure in the first place.
And that concept of the unapproved generic is really where the data gets incredibly complex. Because Fildena isn't just a standard generic you'd pick up at your local neighborhood pharmacy.
Not at all.
When we talk about the generic landscape in pharmaceuticals, a generic medicine is theoretically designed to be bioequivalent to its brand name counterpart.
It should offer the exact same active ingredient, the same dosage strength, and identical clinical effectiveness.
Usually at a significantly reduced price point, since the manufacturer isn't trying to recoup $1 billion in research and marketing.
On paper, the generic model is highly efficient. It democratizes access to vital treatments. But the critical variable in that equation is regulatory oversight.
The bioequivalence is only guaranteed if someone is actually checking the homework.
Right. If a rigorous regulatory body actually tests it, verifies the manufacturing process, and legally certifies that it matches the brand name standard.
And this is where the iMedix database throws up a glaring red flag. If you pull up the specific entry for Fildena and look under the drug status category, there is a stark, unmistakable label.
Yes.
It explicitly lists Fildena as not approved.
To understand the gravity of that not approved label, we really have to look at how the iMedix platform categorizes its broader medication database. They draw a very hard, distinct line between drugs that have survived rigorous regulatory scrutiny and those operating entirely outside of it.
The contrast is genuinely striking. On one side of the database, you have a section featuring a bright green checkmark labeled FDA approved.
The gold standard.
Right. This list includes standard, globally recognized medications. You see names like Rybelsus, Diflucan, Amoxicillin, Fibromycin, Zithromax, Proscar, and Levitra. These have all been thoroughly vetted by the United States Food and Drug Administration.
Earning that FDA green light requires an exhausting multi-year process. The manufacturer has to submit exhaustive clinical trial data.
Proving it works.
Proving efficacy, yes, but also long-term safety. It involves intense on-site inspections of the manufacturing facilities to guarantee good manufacturing practices.
They check everything.
The FDA verifies the purity of the raw materials, the consistency of the active ingredient from batch to batch, and the stability of the final product. When a drug is FDA approved, you have a federally backed guarantee of exactly what you are putting into your body.
But then you scroll down the iMedix platform to the reference list of non-FDA approved generics.
Oh.
Every single medication on this list is stamped with a red X.
And the sheer volume of drugs on this list is staggering.
It really is. Fildena is sitting right there, not approved. But it's surrounded by dozens of others.
Yeah.
Kamagra, Kamagra Jelly, Vitalista, Senforce, Suhagra, Tadasip, Silagra, Zagra 100, Cialis Black, Tatapox, Lady Era, Prilit.
And the list goes on and on.
It represents a massive catalog of unapproved pharmaceutical compounds.
The existence of that list points to a sprawling, highly lucrative global market for PDE5 inhibitors that basically operates in the shadows of traditional regulated healthcare frameworks.
And the dossier actually traces the origin of Fildena. It's manufactured by a company called Fortune Healthcare PVT Ltd, and the text explicitly notes it is manufactured in India.
Now, it's important to note India has a massive, highly capable pharmaceutical sector. They produce a huge percentage of the world's legitimate approved generic drugs.
Right, so the geographic location isn't the inherent issue.
No, it's the specific regulatory status of this particular product. The core issue for you, the consumer, to consider is the implication of that missing oversight.
When a drug is globally manufactured and distributed, but deliberately lacks approval from major regulatory authorities like the FDA or the European Medicines Agency, the safety profile essentially evaporates.
The quality control protocols of the specific manufacturing plant, the purity of the sildenafil citrate being synthesized, the binding agents used in the tablet, none of that has been independently verified.
You are relying entirely on the manufacturer's self-reported internal standards.
You're just taking their word for it.
And when you're dealing with a potent vasodilator like sildenafil, relying on the honor system for quality control introduces incredible risk.
It does.
That risk becomes painfully obvious when we analyze the dosage guidelines presented in the source, because the milligrams dictate everything about how this drug interacts with the body.
In pharmacology, the therapeutic window is everything. It's the delicate balance between the minimum dose required to achieve the desired clinical effect and the maximum dose before severe toxicity sets in.
With PDE5 inhibitors, finding that exact right milligram count is critical to avoiding severe adverse reactions.
The iMedix guide outlines the medically established dosing protocols. For a standard adult male treating erectile dysfunction, the typical starting dose is 50 milligrams, administered as a single tablet.
And the pharmacokinetics dictate taking it approximately 30 to 60 minutes prior to anticipated sexual activity.
Giving the compound sufficient time to absorb into the bloodstream and inhibit those target enzymes, once optimal plasma concentrations are reached, the clinical efficacy of the medication can persist for a window of roughly 4 to 5 hours.
But that 50 milligram baseline is subject to adjustment. A prescribing physician might down-titrate the dose to 25 milligrams if the patient is particularly sensitive to the vasodilation and experiencing adverse effects like profound dizziness or severe headaches.
Conversely, if the 50 milligram dose is well tolerated but clinically insufficient, the dose can be titrated up to a strict maximum of 100 milligrams.
The strict maximum.
That 100 milligram threshold is a hard ceiling established by exhaustive medical research. The documentation is definitive on this point. Exceeding 100 milligrams does not offer greater clinical benefit.
It just exponentially increases the risk and severity of adverse side effects.
Exactly. Furthermore, the protocol strictly limits administration to a single dose within any 24-hour period to prevent dangerous accumulation of the drug in the patient's system.
There's also a really fascinating pharmacokinetic variable discussed in the source regarding administration. The guidelines note Fildena can be taken with or without food.
Yes.
However, there's a major caveat regarding high-fat meals that dramatically alters how the drug behaves.
This is a perfect example of how ordinary dietary choices can profoundly disrupt medical treatments. If a patient consumes a high-fat meal, perhaps a heavy steak or fried food, prior to taking the medication, it alters the gastric emptying rate.
The body has to divert significant energy and resources to breaking down those complex lipids in the digestive tract.
Because the stomach is essentially preoccupied with digesting the fat, the absorption of the sildenafil citrate into the systemic circulation is heavily delayed.
The iMedix guide points out that a high-fat meal can delay the onset of clinical action by upwards of a full hour.
From a practical standpoint, if a patient expects efficacy in 30 minutes but just ate a heavy dinner, they might erroneously conclude the dose was a failure.
And then what do? They potentially take a second pill.
Which is incredibly dangerous. That kind of accidental double dosing is exactly why patient education is so critical.
But the risk of accidental overdose pales in comparison to the deliberate manufactured risk we see when we look at the extreme variants listed in the database.
This is where the unregulated nature of this market becomes truly alarming.
The iMedix database lists the standard therapeutic strengths we just discussed: 25 milligrams, 50 milligrams, and Fildena 100 milligram tablets. But then it details the existence of a specific high-dose variant called Fildena double 200 milligrams.
A single tablet containing 200 milligrams of unverified sildenafil citrate.
It's a massive anomaly. If medical science has established that 100 milligrams is the absolute upper limit for safe therapeutic use, the mere existence of a 200 milligram single-dose tablet on the commercial market is a glaring patient safety hazard.
You are essentially taking double the maximum allowable dose of a potent cardiovascular drug right out of the gate.
The medical consensus provided in the source material is unequivocal regarding these extreme high-dose variants. The expert review states clearly that 200 milligram products are completely unapproved by any major regulatory authority for the standard treatment of erectile dysfunction.
They operate entirely outside the boundaries of evidence-based medical protocols. Taking a 200 milligram dose essentially saturates the PDE5 receptors and drives the vasodilation to a systemic extreme.
You aren't just increasing the likelihood of mild side effects. You're actively inviting severe, potentially life-threatening adverse reactions.
The clinical guidance notes that a dose of this magnitude would only ever be considered under the most intense, closely monitored medical supervision.
Typically only in specialized cases where standard maximum doses have comprehensively failed.
It is absolutely not intended for casual, self-administered use by a consumer buying unregulated pills online. The presence of the 200 milligram variant perfectly illustrates the danger of that not approved status we talked about.
Because in a regulated FDA environment, a manufacturer couldn't simply double the maximum safe dose and sell it without massive clinical trials proving its safety.
But in this gray market, they can simply press a bigger pill and ship it. And when patients ingest those extreme doses, they subject their entire circulatory system to massive stress.
Which leads directly to the cascade of side effects outlined in the dossier. Let's transition into that physical reality, because when Fildena enters the bloodstream, its effects range from the somewhat quirky to the absolutely critical.
As we noted, the side effects are primarily driven by the drug's mechanism of action. It's designed to relax blood vessels in a specific area, but the drug circulates systemically.
It doesn't discriminate.
No, it relaxes smooth muscle tissue throughout the entire body, so we see a classic presentation of systemic vasodilation.
The source categorizes these common side effects as mild to moderate, noting they are often transient as the body acclimatizes to the sudden shift in vascular tone.
Headaches are incredibly common, which makes perfect sense. When the blood vessels in the cranium dilate and expand, it increases pressure and triggers that throbbing pain.
The text even suggests that maintaining proper hydration can help mitigate the severity of these vasodilation headaches.
Facial flushing is another frequent symptom. Patients experience a sudden redness or intense warmth in the face and neck due to the rapid pooling of blood in the capillaries near the surface of the skin.
You also see complaints of nasal congestion or a persistent runny nose, again caused by the engorgement of the vascular tissue inside the nasal cavity.
And gastrointestinal distress, presenting as indigestion or an upset stomach, is frequently reported as the smooth muscle lining the digestive tract reacts to the PDE5 inhibition.
Those are standard, somewhat expected reactions to a vasodilator. But the iMedix database details another side effect that is genuinely fascinating from a biochemical perspective.
What's fascinating here is the visual disturbances.
Specifically, users report their vision taking on a mild, temporary blue tinge, accompanied by an increased sensitivity to bright light.
The clinical explanation for that blue-tinted vision is a brilliant example of how complex pharmacology can be. Fildena is engineered to selectively target and inhibit the phosphodiesterase type 5 enzyme.
But synthetic molecules are rarely perfect.
Exactly. Sildenafil has what's known as a cross-reactivity profile. It exhibits a mild inhibitory effect on a closely related enzyme known as PDE6.
And the location of PDE6 is the key here. It's not in the blood vessels.
Correct. PDE6 is an enzyme located almost exclusively within the photoreceptor cells of the retina in the eye.
In the eye.
It plays an absolutely critical role in the phototransduction cascade. That's the process by which our eyes convert light into electrical signals that the brain interprets as vision and color.
So when the sildenafil circulating in the bloodstream accidentally inhibits a fraction of that PDE6 enzyme in the retina,
It temporarily disrupts color perception, creating that synopsia or blue-tinted visual field.
it's an incredible biological accidental overlap. You take a pill to alter blood flow, and it inadvertently bumps into a color processing enzyme in your retina.
Now, for most users, this is a temporary, harmless quirk.
However, the source material includes a very specific, serious caution regarding this retinal interaction. It states that patients suffering from retinitis pigmentosa must use Fildena with extreme caution.
Due to a theoretical risk of exacerbating their vision loss, retinitis pigmentosa is a progressive genetic degenerative disease of the eye that involves the steady breakdown of the retinal cells.
Because sildenafil is known to directly interact with the retinal enzyme PDE6, introducing this chemical into a retina that is already severely compromised by a genetic disorder carries unknown, potentially compounding risks to the patient's long-term vision.
It's a prime example of why a comprehensive medical history is required before prescribing this class of drugs.
And that visual interaction provides a natural bridge to the severe emergency side effects documented in the source. While the blue tint is usually benign, the iMedix guide issues a stark warning.
If a patient experiences any of the following severe adverse reactions, they must immediately cease taking the medication and seek emergency medical intervention.
These events are statistically rare, but they are catastrophic when they occur. The most alarming visual emergency is a sudden, precipitous decrease or total loss of vision in one or both eyes.
This is indicative of a condition called non-arteritic anterior ischemic optic neuropathy, or NAION.
NAION essentially acts like a stroke in the eye, correct?
Functionally, yes. It's an abrupt interruption of blood flow to the optic nerve, leading to rapid, often irreversible ischemic damage.
The text notes that the risk of triggering NAION may be elevated in men who already have underlying cardiovascular risk factors or pre-existing anatomical crowding of the optic disc.
Similarly, patients can experience a sudden decrease or total loss of hearing, often accompanied by tinnitus or dizziness, indicating severe inner ear vascular disruption.
And crucially, the source warns patients to be hypervigilant for the classic signs of a myocardial infarction or heart attack: severe chest pain, profound nausea, or radiating pain spreading down the arm or up into the jaw.
Any of those symptoms mandate an immediate 911 call.
But there is one final severe side effect we have to analyze, as it is perhaps the most heavily publicized warning associated with any ED medication: the risk of priapism.
Priapism is a highly specific, dangerous medical condition defined as a prolonged, unwanted, and often excruciatingly painful erection that persists for more than 4 hours.
It is universally classified by the medical community as an absolute urological emergency.
That 4-hour threshold is critical. If a patient crosses that mark, the clinical reality becomes very grim. The mechanics of priapism are essentially the body's vascular system becoming trapped in a localized, high-pressure state.
The PDE5 inhibition forces the blood vessels to remain dilated, continuously pumping arterial blood into the tissue.
However, the venous outflow, the mechanism that drains the blood back into the circulatory system, becomes compressed or functionally blocked. You end up with a localized blood trapped in the penis.
Because the blood is stagnant and not circulating, it rapidly becomes depleted of oxygen.
It becomes an ischemic environment. The tissue is literally starving for oxygen.
Without immediate aggressive medical intervention in an emergency room, often involving physically aspirating the trapped blood with a needle or administering counteracting medications to force vascular constriction, the hypoxia will cause tissue necrosis.
The smooth muscle tissue begins to die and is replaced by inflexible scar tissue.
The tragic irony of untreated priapism is that the permanent tissue damage guarantees severe, irreversible erectile dysfunction. The patient is left permanently unable to achieve an erection, entirely defeating the purpose of taking the medication in the first place.
It's a devastating outcome that requires acute awareness. The source material also identifies specific high-risk populations who are biologically predisposed to priapism and must approach PDE5 inhibitors with extreme caution.
The clinical guidance specifically highlights men with conditions that alter red blood cell morphology or overall hemodynamics.
Patients with sickle cell anemia are at a significantly heightened risk, as their misshapen red blood cells can easily occlude the venous outflow tract, trapping the blood.
Similarly, patients with leukemia or multiple myeloma face elevated risks due to hyperviscosity of the blood.
The text also warns that men with physical anatomical deformities of the penis, specifically citing Peyronie's disease, are at high risk.
Peyronie's involves the development of fibrous scar tissue inside the penis, causing curvature. When you artificially force massive vasodilation into an area already compromised by restrictive scar tissue, the mechanics of blood flow are severely disrupted, easily triggering a priapic episode.
This exhaustive list of severe reactions and physiological risk factors underscores the fundamental danger of bypassing the medical system. A patient quietly buying an unapproved generic online might not realize their underlying sickle cell trait or early-stage Peyronie's disease makes that pill a ticking time bomb for a urological emergency.
Which perfectly sets the stage for the most complex part of the iMedix dossier, the interaction minefield.
Taking this drug in isolation carries enough risk, but when you begin mixing it with other substances, the pharmacology becomes exponentially more dangerous.
Let's start with the absolute non-negotiable contraindication outlined in the text.
This is the single most critical safety warning in the entire database. It is a zero-tolerance policy.
Fildena must never, under any circumstances whatsoever, be ingested by individuals who are concurrently using any form of organic nitrate or nitric oxide donor.
The source provides a clear breakdown of what falls into this category. It includes standard prescription nitrates utilized for the management of angina or severe cardiovascular disease medications like nitroglycerin patches or sprays, isosorbide mononitrate, and isosorbide dinitrate.
But the warning also explicitly extends beyond the pharmacy counter into the realm of recreational drug use.
Yes, the text specifically identifies street drugs, commonly known as poppers, which are chemically classified as amyl nitrate or butyl nitrate.
If a patient mixes a PDE5 inhibitor like Fildena with any of these nitrate compounds, whether it's an older man taking nitroglycerin for his heart or a younger man using poppers at a club, the pharmacological interaction is severe and frequently fatal.
Let's break down exactly why these two specific chemicals create such a catastrophic biological event. The danger stems from a compounding synergistic effect on the vascular system.
Sildenafil operates by inhibiting PDE5, which ultimately promotes vasodilation and lowers blood pressure.
Nitrates operate through a different chemical pathway, acting as powerful nitric oxide donors, but the end result is the same: massive systemic vasodilation.
They're essentially two entirely different drugs slamming their feet on the exact same physiological gas pedal.
Precisely. When you introduce both agents into the bloodstream simultaneously, the vascular smooth muscle receives an overwhelming chemical signal to relax. The blood vessels dilate to an extreme, unnatural degree.
This triggers a profound, sudden, and catastrophic drop in systemic blood pressure. The clinical term is refractory hypotension.
The blood pressure plummets so rapidly and so deeply that the heart simply cannot generate enough force to pump oxygenated blood against gravity up to the brain and other vital organs.
The cardiovascular system essentially collapses. The patient experiences sudden syncope or fainting.
The lack of perfusion to the cardiac muscle itself can instantly trigger a massive myocardial infarction, and the lack of oxygen to the brain frequently results in a severe ischemic stroke or immediate death.
The synergistic effect is so reliable and so deadly that the combination is absolutely, strictly prohibited across all medical guidelines.
So nitrates represent the absolute do not mix category, but the dossier outlines several other classes of medication that, while not universally prohibited, require intense clinical caution and careful dose titration.
The most prominent example being alpha blockers.
Alpha blockers are a very common class of prescription drugs utilized primarily for the management of essential hypertension, high blood pressure, as well as a urological condition called benign prostatic hyperplasia, or BPH, which involves an enlarged prostate gland.
The source lists common examples like tamsulosin, widely known by the brand name Flomax, alongside doxazosin and terazosin.
The interaction here is an issue of additive effects. Alpha blockers, by their very nature, work to lower blood pressure. When you introduce Fildena into a system already influenced by an alpha blocker, you are stacking two separate blood pressure-lowering agents on top of each other.
It might not trigger the violently sudden collapse seen with nitrates, but the additive hypotensive effect can easily push the patient's blood pressure dangerously low.
They might experience severe dizziness upon standing, debilitating lightheadedness, or sudden fainting spells that result in traumatic injuries.
Because of this additive risk, the clinical recommendation provided in the text is very strict. If a patient absolutely must be on both medications, the alpha blocker regimen must be completely stable first.
And when the Fildena is finally introduced, it must be initiated at the absolute lowest possible dose, that 25 milligrams starting point we discussed earlier, to carefully monitor the patient's hemodynamic response.
This identical cautious approach applies to all other antihypertensive medications as well, including ACE inhibitors, beta blockers, calcium channel blockers, and standard diuretics.
Now, navigating prescription interactions is complex enough, but the iMedix database highlights an interaction that catches almost everyone completely off guard because it involves a common breakfast item.
The text explicitly warns patients to avoid consuming grapefruit or grapefruit juice while taking Fildena. What is the specific biochemical mechanism that makes a piece of citrus fruit dangerous to mix with a synthetic pharmaceutical?
The grapefruit juice interaction is a classic study in pharmacokinetics, specifically focusing on how the body metabolizes and eliminates foreign compounds. Once sildenafil has completed its clinical task, it doesn't just vanish. It has to be broken down and cleared from the system.
This metabolic heavy lifting is performed primarily in the liver and the walls of the small intestine by a very specific, highly active enzyme called cytochrome P450-3A4, or CYP3A4 for short.
So CYP3A4 is essentially the body's chemical disposal system for this specific drug.
Exactly. Its job is to dismantle the sildenafil molecule so it can be excreted. Now, grapefruit juice contains a high concentration of specific organic compounds known as furanocoumarins.
When these compounds enter the digestive tract, they act as potent CYP3A4 inhibitors. They literally bind to the enzyme and temporarily paralyze it, blocking it from performing its metabolic function.
The disposal system gets completely shut down, and the clinical implication of that is massive. Because the CYP3A4 enzyme is inhibited by the grapefruit juice, it cannot break down the sildenafil circulating in the bloodstream.
The drug isn't cleared out. Instead, it continues to accumulate. The plasma concentration levels of the drug spike dangerously high, completely altering the area under the curve of the intended dosage.
A patient might have taken a safe, standard 50 milligram dose, but because the body can't clear it, the blood levels rise as if they had taken an unregulated 150 milligram dose.
This dramatically raises the risk and severity of all the severe side effects we detailed earlier, including the visual disturbances and the risk of priapism.
And it's crucial to note that grapefruit juice is simply the most common dietary inhibitor. The source material emphasizes that several major prescription drugs act as powerful CYP3A4 inhibitors as well.
Certain macrolide antibiotics, such as erythromycin and clarithromycin, specific antifungal medications like ketoconazole and itraconazole, and HIV protease inhibitors like ritonavir, all paralyze that exact same enzyme.
Mixing Fildena with any of these requires an immediate dose reduction to prevent toxic accumulation in the blood.
But the metabolic pathway can also be disrupted in the exact opposite direction. The dossier also warns about CYP3A4 inducers.
If an inhibitor paralyzes the enzyme, an inducer essentially throws the enzyme into overdrive. The source lists potent pharmaceutical inducers like the antibiotic rifampin, anti-seizure medications like carbamazepine and phenytoin, and notably a very common over-the-counter herbal supplement called St. John's wort.
When a patient takes St. John's wort, it signals the CYP3A4 enzyme to radically accelerate its metabolic activity. The enzyme begins breaking down the sildenafil much faster than normal.
The blood levels of the drug decrease so rapidly that the patient may never reach the required therapeutic concentration. The drug is essentially cleared out of the system before it even has a chance to work, rendering the treatment entirely ineffective.
The sheer complexity of these metabolic interactions, from heart medications and antibiotics to herbal supplements and citrus fruit, reinforces why a comprehensive review of a patient's entire medicine cabinet by a licensed pharmacist or physician is non-negotiable before initiating therapy.
And we still have to address one of the most common concomitant substances, alcohol. The iMedix safety advice clearly, definitively labels the interaction between Fildena and alcohol as unsafe.
Combining the two is medically counterproductive for several compounding reasons. First, alcohol is, in its own right, a systemic vasodilator. It relaxes blood vessels and depresses blood pressure.
By consuming alcohol while taking Fildena, the patient is intentionally amplifying the drug's hypotensive side effects, practically guaranteeing an onset of severe dizziness, throbbing headaches, and intense facial flushing.
But the secondary reason is almost painfully ironic.
Indeed. Chronic or acute excessive alcohol consumption is a thoroughly documented primary physiological cause of erectile dysfunction.
Alcohol is a central nervous system depressant. It blunts the neurological signals required to initiate arousal and suppresses the release of nitric oxide.
By drinking heavily, the patient is actively exacerbating the precise physiological failure the medication is designed to treat, essentially canceling out the PDE5 inhibitor's clinical efficacy entirely.
This entire discussion regarding blood pressure drops and vascular stress circles back to a fundamental warning in the text regarding the cardiovascular strain of sexual activity itself. We have to view the medication in the context of its intended use.
Sexual intercourse is a significant physical exertion. It elevates the heart rate and places a measurable demand on the cardiac muscle. Because Fildena induces a temporary systemic decrease in blood pressure, it is completely contraindicated for men for whom the physical exertion of sexual activity is clinically inadvisable due to severe underlying cardiovascular disease.
The clinical guidelines list specific high-risk cardiac profiles that preclude the use of this drug. This includes men suffering from severe congestive heart failure, those experiencing unstable angina, patients with wildly uncontrolled high or low blood pressure, or individuals with a recent acute history of a stroke, a myocardial infarction, or a life-threatening cardiac arrhythmia.
For a patient in a compromised cardiovascular state, combining the sudden vasodilation of the drug with the acute physical exertion of sexual activity could easily trigger a fatal cardiac event. It requires a meticulous risk-benefit analysis by a cardiologist.
Which, again, shines a glaring spotlight on the extreme danger of acquiring an unapproved generic online without undergoing that vital cardiovascular assessment.
This naturally leads us into analyzing the specific demographic groups outlined in the source. Let's look at the special populations and the practical realities of who should and shouldn't be engaging with this medication.
The iMedix guide establishes very hard demographic boundaries. Fildena is entirely unapproved, unsafe, and contraindicated for use by women.
It has no approved clinical indication for treating any condition during pregnancy, and the pharmacokinetics regarding its presence in breast milk dictate that it should absolutely not be taken by women who are breastfeeding.
It is also strictly forbidden for pediatric use. The medication is completely unsafe and not indicated for anyone under the age of 18.
And the text provides a very nuanced, critical clarification regarding another serious medical condition, pulmonary hypertension.
This is a vital point regarding formulation and dosing. The active ingredient, sildenafil, is actually utilized to treat a severe, unrelated condition known as pulmonary arterial hypertension, which is characterized by dangerously high blood pressure, specifically within the arteries of the lungs.
There is an FDA-approved, brand-name formulation of sildenafil marketed specifically for this condition under the name Revatio.
However, the iMedix dossier explicitly warns that Fildena tablets, which are dosed and formulated specifically for treating ED, are not indicated, approved, or safely dosed for the treatment of pulmonary hypertension.
A patient suffering from PAH cannot simply swap out their highly regulated Revatio prescription for a cheap, unapproved ED generic. The milligram dosages, the administration intervals, and the clinical monitoring protocols for the two conditions are entirely different. Attempting to self-medicate a severe pulmonary condition with an unregulated generic is incredibly dangerous.
And when we look at the geriatric population, men aged 65 and older, the clinical approach requires significant modification. The physiological reality is that as the human body ages, its ability to metabolize and excrete pharmaceuticals diminishes. Hepatic and renal clearance rates slow down.
Because the elderly patient processes the drug much slower, the sildenafil remains active in their bloodstream for a longer duration, making them profoundly more sensitive to the drug's systemic effects, particularly the sudden blood pressure drops and resulting dizziness.
The clinical mandate is that if an elderly patient is cleared for use, they must invariably be started at the absolute minimum 25 milligram dose to mitigate the risk of severe hypotensive events and subsequent fall injuries.
The text also emphasizes practical, daily safety warnings regarding neurological impairment. Because the vasodilation can trigger sudden dizziness, unexpected drops in blood pressure, or those temporary visual disturbances we discussed, the drug can severely impair a patient's spatial awareness and reaction times.
The official guidance strongly advises patients to exercise extreme caution and entirely avoid driving vehicles or operating heavy, potentially dangerous machinery until they have established exactly how their body reacts to the medication.
Facing this massive, intimidating list of severe side effects, potential drug interactions, and lifestyle restrictions, it's incredibly common for patients to seek an easier way out. They look for workarounds.
And the iMedix FAQ tackles the most common workaround directly, the natural alternatives myth. Patients constantly search the database asking if there is a natural over-the-counter herbal supplement that provides the same clinical effect without the pharmaceutical risks.
The clinical reality provided by the database is stark and uncompromising. There's currently no over-the-counter natural dietary supplement that has been scientifically proven to be both as safe and as effective as prescription PDE5 inhibitors for the treatment of erectile dysfunction.
Yet we see these supplements aggressively marketed everywhere, in convenience stores, gas stations, and massive online ad campaigns promising all-natural herbal enhancement.
And that unregulated marketplace is precisely where the greatest hidden danger lies. The source material warns that the dietary supplement industry lacks the rigorous pre-market safety testing required of pharmaceuticals.
Alarmingly, regulatory testing frequently reveals that many of these highly marketed natural supplements are actually tainted with hidden, undeclared, synthetic active pharmaceutical ingredients.
So a consumer purchases a box labeled as a proprietary blend of natural herbal roots, believing they are making a safe holistic choice, but the capsule is actually packed with unmeasured, unlisted, illicitly manufactured sildenafil powder.
Exactly. They are unknowingly ingesting the exact pharmaceutical drug they were attempting to avoid, but under the worst possible conditions. They have zero quality control regarding the purity of the chemical, absolutely no knowledge of the actual milligram dosage they are consuming, and they receive none of the critical safety warnings regarding nitrate interactions or cardiovascular risks that we just spent the last hour dissecting.
The database is unequivocal. The only genuinely safe approach to treating this condition involves a proper clinical diagnosis and a highly regulated treatment plan managed by a licensed physician.
This complex intersection of medical risk and consumer behavior brings us to the final and perhaps most revealing section of our deep dive, the human element.
Here's where it gets really interesting. We've spent the bulk of our time analyzing enzymatic pathways, vascular dynamics, and international regulatory structures. But the iMedix platform also hosts a vibrant comments section.
Analyzing the raw, unedited behaviors and statements of real users interacting with this database provides a profound window into the cultural psychology of modern healthcare consumers.
It serves as a fascinating, real-time sociological cross-section of how patients attempt to navigate a fragmented, heavily digital healthcare ecosystem. Let's analyze the first comment highlighted in our dossier. It comes from a user posting under the handle Jimrat77, submitted in September 2024.
He writes, Fildena is a game changer. I've tried a few other options, but this one stands out for its reliability and fast action.
This encapsulates the perspective of the enthusiast. If you strip away the medical context, Jimrat77 sounds exactly like a satisfied consumer dropping a 5-star review for a new pre-workout supplement or a high-performance running shoe.
He evaluates the drug purely on metrics of performance. It's a game changer. It possesses fast action. It's reliable.
While his individual positive experience is certainly valid from a consumer standpoint, as analysts focused on patient safety, we have to critically contrast his enthusiasm against the severe clinical reality we've established today.
Framing a potent, systemically acting PDE5 inhibitor merely as a fast-acting game changer actively trivializes the profound medical nature of the compound. It entirely strips away the context that this is a serious cardiovascular altering medication that requires an underlying clinical diagnosis.
The enthusiasm is genuine, but it deeply underscores the absolute necessity for medical gatekeeping before an unvetted consumer attempts to chase a game-changing physiological result without understanding the physiological cost.
It's the danger of treating a serious pharmaceutical intervention like an energy drink. It's a compound that alters blood pressure and interacts with retinal enzymes. It's not a lifestyle accessory.
Now let's contrast the enthusiast with another distinct user profile found in the comments. The cost-conscious patient. We have a comment from a user named Henry, posted back in May 2019. Henry poses a direct question. Interesting why this drug is the cheapest one among the other meds with sildenafil.
Henry's question cuts straight through the clinical data and exposes the raw economic reality driving the global generic pharmaceutical market.
It does. And the iMedix editorial team administrator actually engaged with Henry, issuing a reply in 2024. The admin systematically corrected his assumption, stating, "Hello, this drug is not the cheapest one on the market. There are so much more drugs with a lower cost and with the same active substance. You can check them out on this website using the search button option."
When we examine Henry's initial premise and the administrator's subsequent correction, it reveals a massive, hyper-competitive online ecosystem. Patients are actively, aggressively scouring global databases to hunt down the absolute lowest possible price point for synthesized sildenafil.
The source material, under its section detailing cost considerations and generics, explicitly references the search query, Fildena 100 milligram price in India. It notes that because the chemical is manufactured overseas, it may command a lower price in that specific domestic market, fueling international demand.
We're seeing consumers acting as global commodities traders, searching internationally to shave pennies off a pill. But the text provides a crucial, life-saving warning to patients engaged in this behavior.
It states definitively that patients must prioritize obtaining genuine, quality-assured medication from a licensed, verified source over the relentless pursuit of the lowest possible price from unverified, anonymous sellers.
The clinical logic there is undeniable. When a consumer is participating in a race to the bottom regarding price within an entirely unregulated, shadowy global market, what essential elements of the drug's production are being sacrificed to achieve that discount?
Are they sacrificing chemical purity? Are they abandoning manufacturing quality control? Are they ignoring basic safety protocols?
The patient's quest for affordable generic treatment is deeply understandable given the exorbitant cost of brand-name healthcare, but it introduces immense, unquantifiable risk when that pursuit leads them outside the protective boundaries of licensed, heavily regulated pharmacy networks.
Which brings us to the final and unequivocally most concerning user comment in the dossier, the lost customer. This is a brief comment from a user named Douglas, submitted in April 2019. Douglas writes verbatim, "I'm just wondering why I can't see my order."
From a patient safety and cybersecurity perspective, that is a deeply chilling comment once you grasp the actual nature of the platform Douglas is interacting with.
Exactly. iMedix is strictly an informational database. They compile safety data, they publish educational articles, and they host user reviews. They are a library, not a pharmacy. Yet Douglas genuinely believes he just executed a financial transaction and purchased prescription drugs directly from their server.
The iMedix editorial team administrator was forced to reply to Douglas to clarify this critical misunderstanding, stating very clearly, "We do not sell medicines, we only do reviews for informational purposes. You can directly contact the seller from whom you purchased this or that drug."
Douglas is completely lost in the digital wilderness. He attempted to purchase a highly potent prescription-only cardiovascular drug online, almost certainly from a fraudulent, shadowy website operating illegally. And now his illicit order has vanished into the ether, and he is so technologically disoriented that he's demanding customer service from an unrelated medical encyclopedia.
This singular interaction highlights a massive systemic patient safety crisis detailed in the dossier: the danger of rogue pharmacies.
The iMedix FAQ explicitly addresses this exact digital threat. It aggressively warns patients to remain extremely vigilant and wary of any online entity that offers to sell and ship prescription medications without legally requiring a valid prescription from a licensed physician.
These rogue online pharmacies are inherently predatory operations. The text notes with alarm that these illicit sites are the primary global distribution networks for counterfeit, adulterated, and exceptionally dangerous medical products.
If Douglas actually does eventually receive a package in the mail from whatever anonymous, untraceable overseas seller he wired money to, he has absolutely no mechanism to verify the contents of that pill.
It could be pressed flour, it could be contaminated with heavy metals or industrial byproducts, or, terrifyingly, it could be one of those unregulated, extreme 200 milligram overdose variants we analyzed earlier.
And if Douglas happens to suffer from a pre-existing, undiagnosed cardiac condition, or if he is concurrently taking a prescription nitrate or an alpha blocker, and he ingests that unverified mystery pill, completely devoid of any physician's oversight, the physiological consequences could be rapid and catastrophic.
Douglas's brief, confused comment serves as the perfect, tragic encapsulation of the profound dangers inherent in the unregulated online drug trade.
It truly is a stark warning. The deeper we dig, the more complex the picture becomes. So how do we synthesize all of this? Let's zoom out and summarize the massive analytical journey we've undertaken today based on the iMedix database.
We started by examining the fundamental blueprint of Fildena. We explored the elegant mechanics of PDE5 inhibitors, detailing exactly how they manipulate cellular enzymes to relax vascular smooth muscle.
We aggressively dismantled the pervasive cultural myth that these drugs act as magic aphrodisiacs, establishing that physical and psychological arousal are absolute non-negotiable prerequisites for the drug to function.
We then navigated the incredibly dense, confusing landscape of international generics. We drew a hard contrast between the rigorous, scientifically validated safety profile of FDA-approved medications and the shadowy, highly concerning, not approved status of Fildena, and dozens of other globally manufactured variants flooding the gray market.
We waded deep into the dosage danger zone. We outlined the medically established 50 milligram starting point, the specific pharmacokinetic delays caused by high-fat meals, and we analyzed the terrifying reality of the medically unapproved, highly dangerous Fildena double 200 milligram extreme variants designed to bypass safety ceilings.
We systematically categorize the physiological side effects, ranging from the mild, mechanistically expected vasodilation symptoms like headaches and flushing, to the biochemically fascinating, such as the temporary blue tinge in the visual field caused by the accidental cross-inhibition of the retinal enzyme PDE6.
We then transitioned to the severe, terrifying urological emergencies like priapism, detailing the ischemic cascade that leads to tissue hypoxia and the potential for permanent, irreversible vascular damage.
We mapped out the complex interaction minefield. We highlighted the absolute life-threatening cardiovascular contraindication involving organic nitrates and recreational poppers. We explored the additive, dangerous, hypotensive effects of stacking the drug with alpha blockers.
And we uncovered the surprising, profound metabolic disruption caused by a simple glass of grapefruit juice, detailing how it paralyzes the hepatic CYP3A4 enzyme and triggers toxic drug accumulation in the bloodstream.
We clearly delineated the special populations who must avoid this compound entirely, including women and pediatric populations, while emphasizing the extreme caution and down titration required for elderly patients.
We also systematically dismantled the dangerous myth of safe, natural, herbal alternatives, exposing the unregulated dietary supplement market as a frequent vector for hidden, illicit pharmaceutical ingredients.
And finally, we examined the human element. We analyzed the real-world comments from GymRat77, Henry, and Douglas, revealing a fractured culture of online consumers who are desperately chasing game-changing physiological results and bottom-barrel international prices, often falling prey to the extreme, unverified dangers of predatory rogue online pharmacies.
Understanding the intricate details of all these nuances is absolutely paramount for anyone engaging with the modern healthcare system. You simply cannot ingest a potent systemic cardiovascular drug just because an anonymous enthusiast on a forum promised it worked for him.
You must actively, continuously engage your critical thinking.
Before we close out this session, a brief reminder that this entire exhaustive deep dive was fueled by the incredibly detailed educational architecture provided by the iMedix platform. Digital resources like the iMedix database exist to empower people like you to better understand complex health metrics, decode confusing pharmacological treatments, and elevate the overall global discourse surrounding patient safety.
They aggregate the raw data so we can have these vital, potentially life-saving analytical conversations. And as we conclude this deep dive, I want to leave you with a final, highly provocative thought to mull over regarding the nature of modern healthcare.
Consider the profound psychological paradox we've uncovered throughout this analysis. We currently live in an era of truly unprecedented scientific and pharmacological achievement.
Incredibly potent, synthetically precise, and scientifically proven molecules like sildenafil citrate are fully understood and readily available to effectively treat deeply complex physiological conditions.
The raw science is undeniably there, and it's highly effective.
It is a marvel of modern medicine. Yet, despite this regulated abundance of proven treatments, patients are increasingly and entirely willingly abandoning the safety of the clinic to navigate a shadowy, completely unregulated digital marketplace.
They're willingly risking their financial security on counterfeit operations. They're risking their physiological health on extreme, unapproved dosages. They are risking their very lives on unknown, unmonitored enzymatic interactions.
And they are engaging in all of this dangerous behavior specifically to bypass the traditional medical gateways, the licensed physicians, the verified pharmacists, and the regulatory agencies that were constructed entirely to protect them from harm.
It is a massive, profound behavioral contradiction.
It truly is. How does the desperate human quest for accessible, affordable medical treatment end up completely compromising the very physiological safety it seeks to provide? Why do we instinctively run from the structured, monitored safety of the clinical environment straight into the chaotic, unverified danger of the rogue online pharmacy?
It is a question rooted just as deeply in human sociology and consumer psychology as it is in clinical pharmacology. And it is something you should critically evaluate the next time you or someone you know turns to a search engine looking for a quick, unverified medical fix.
That is a brilliant, unsettling point to end our analysis on.
Thank you, as always, for bringing your clinical expertise and breaking down the complex systems behind the data. And a massive thank you to you, our listener, the learner, for taking this exhaustive deep dive with us today. Stay curious about the world around you, stay rigorously informed, and most importantly, stay safe. We'll catch you on the next deep dive.